When Superfund was reauthorized in 1986, Congress required OSHA to develop regulations that would protect the health and safety of workers engaged in certain hazardous material activities. This regulation is referred to as the HAZWOPER, which stands for Hazardous Waste Operations and Emergency Response. Congress also required the Environmental Protection Agency to develop worker protection regulations identical to the OSHA regulations. The EPA standard protects state and local government workers in the states that do not have an approved OSHA state plan. The required aspects of these two HAZWOPERs are the same. The only difference between the two standards is in the scope of coverage. The EPA standard legally extends coverage to voluntary or non-compensated government workers who are engaged in hazardous material activities in those states without OSHA-approved plans. This program focuses on the emergency planning, training, and medical monitoring requirements of the HAZWOPER standards.
Employees engaged in hazardous waste operations are entitled to health and safety standards that must include worker protection provisions relating to site analysis, training, medical surveillance, protective equipment, engineering controls, air monitoring, informational programs, decontamination procedures, and emergency response plans. These provisions can be found in 29 CFR 1910.120 pertaining to OSHA and 40 CFR 311 for the EPA. The worker protection standards encompass 5 types of operations: required cleanup at uncontrolled hazardous waste sites, corrective action at sites covered by the Resource Conservation and Recovery Act, known as RCRA, voluntary cleanup at uncontrolled waste sites, hazardous waste operations at RCRA treatment storage disposal or TSD facilities, and emergency response operations without regard to location. The key elements of any worker protection program are proper planning, training, and equipment. An employer whose workers are engaged in hazardous waste operations or emergency response must write a plan geared to protecting employees during emergencies. This emergency response plan is best developed with a worst-case scenario in mind. Such a strategy allows the employer to think in extremes and thereby cover all contingencies. The emergency response plan will describe how an actual emergency would be handled so as to minimize risks. There are 3 separate types of emergency response plans under the Worker Protection Standards. Each addresses emergency response at different locations. These locations are uncontrolled hazardous waste sites, TSD facilities, and other hazardous material emergencies such as a transportation accident. Work plans for each of these locations differ in very specific ways. Before work begins at an uncontrolled hazardous waste site, the employer must develop a written, site-specific emergency response plan to handle anticipated emergencies at that site. This emergency response plan must be a separate part of the written, site-specific health and safety plan. For hazardous waste operations and emergency response at a TSD facility, RCRA permitting requirements specify that the facility operator develop a contingency plan. Under the Worker Protection Standards, an emergency response plan will be developed as a separate, written part of the facility's safety and health program. While the employer need not duplicate efforts, the emergency response plan is expected to have considerably more detail than the RCRA contingency plan. Hazardous substance emergencies can happen anywhere. For the most part, these are totally unanticipated. Until someone evaluates the materials involved in such an incident, responders will not know the extent of the hazard. However, specific emergency response planning requirements are also needed for these types of situations. No matter what the type of emergency response, there are certain common elements that can be included in all emergency plans. Pre-emergency planning includes coordination of outside parties, the installation of an on-site alarm system, as well as procedures for reporting emergencies to appropriate local, state, and federal authorities. The plan will define personnel roles, lines of authority, communication, and the on-scene incident commander, known as the OIC. It will discuss evacuation procedures, including safe distances and refuges if the known hazard requires such steps. It will also identify area topography and seasonal meteorological conditions. The location of personal protective equipment and emergency response gear must be identified, along with specific arrangements for the delivery of any additional materials to the site from neighboring areas. Decontamination procedures will be specified. Steps to ensure site security and control must be anticipated to isolate the incident. Lastly, the employer is responsible for a critique of the response and a follow-up that includes updating the plan with new or changing site conditions. As previously mentioned, a hazmat emergency can happen anywhere that such substances exist. The many variables in an emergency response, without regard to location, makes planning the few things that are known extremely important. The lines of authority and communication must be made clear immediately. To this end, the most senior emergency response official arriving on site will become the OIC. This person will control every facet of the operation at the incident site. If possible, the OIC should identify each hazardous substance and/or condition in which workers are engaged or otherwise exposed. The OIC is responsible for security and seeing that only necessary workers are involved in the response so as to minimize the number of exposed individuals. Also, this official must designate a person knowledgeable in the operations being implemented for the specific hazards at the incident site. This person will be called the safety official. The safety official will provide direction in operational safety, including the identification and evaluation of hazards. In the event of a dangerously uncontrollable situation, the safety official will make recommendations to the OIC concerning the altering, suspension, or termination of site activities. According to OSHA, 1.8 million Americans are at risk from exposure to hazardous waste or materials. Who are these workers at risk? 53% are municipal or volunteer firefighters. The next largest group is police officers, comprising 31%. Either of these two categories can include rescue personnel dispatched along with fire or police. Private fire brigades who provide site-specific emergency response make up 10%. Another additional 0.5% are members of private hazmat teams. 3% more work at RCRA facilities. And lastly, 1% are at uncontrolled hazardous waste sites. Yet, prior to OSHA and EPA efforts, these people were usually the least likely candidates for hazmat training. Under the Superfund Amendments and Reauthorization Act, known as SARA, attention was focused on promoting safe work habits, procedures, and techniques. This is achieved through training. The worker protection regulations address this need for training through a tiered approach, which links the type and amount of training directly to a worker's exposure potential. There is a 40-hour training requirement for general site workers involved in cleanup operations at uncontrolled hazardous waste sites. These employees need an additional 24 hours of on-the-job training with an experienced supervisor. That supervisor will have had 8 hours of specialized training in managing hazmat operations over and above the worker requirements. In contrast to that are workers who only come on-site occasionally to do specific jobs. Their training consists of 24 hours off-site and 8 hours on. This would also apply to regular site workers employed in areas that have been characterized to be below exposure levels. RCRA TSD workers also have a 24-hour training requirement. All personnel are required to have annual refresher training. Emergency response personnel, whose exposure risk varies with each response, have 5 levels of training. Level 1 is for responders who are most likely to be first on the scene and who initiate a response, such as police officers or plant security personnel. Training at this level covers recognition and identification of hazardous materials, the potential outcome of such a release, and an awareness of first response duties and limitations. Level 2 responders are those concerned with initiating control of an incident. This group can include police, firefighters, or rescue personnel. They provide the first minimum defensive actions at an incident. Their training includes Level 1 competency and a minimum of 8 hours of training in basic hazard and risk assessment techniques, the selection and use of personal protective equipment, basic control, containment, and confinement operations, basic decontamination procedures, and relevant standard operating and termination procedures. The basis of training for all higher levels of emergency response personnel is this Level 2 competency. Level 3 comprises the hazmat technicians charged with actually trying to stop a release. In addition to meeting certain competency requirements, this group must have a minimum of 24 hours of training in implementing their employer's emergency response plan, classifying, identifying, and verifying hazardous materials, functioning in an assigned role within the incident command system, selecting and using specialized personal protective equipment, understanding hazard and risk assessment techniques, implementing advanced control, containment, and confinement operations and decontamination procedures, and an understanding of termination procedures and basic chemical toxicological terms and behavior. The fourth level consists of hazardous materials specialists who provide expert support to the technicians and may act as site liaisons with government authorities. They must have a minimum of 24 hours of training and competency in the implementation of the local emergency response plan, classifying, identifying, and verifying known and unknown materials using advanced survey instruments and equipment, selecting and using specialized chemical personal protective equipment, understanding in-depth hazard and risk assessment techniques, chemical, radiological, and toxicological terms and behavior, and performing specialized control, containment, confinement operations, and decontamination procedures. The hazmat specialist must also have knowledge of the state emergency response plan and have the ability to develop a site-specific safety and control plan. Emergency responders at the fifth level are on-scene incident commanders, those who assume control in a release or spill incident. The OIC must have 24 hours of training at the operations level, in addition to competency in the following areas: the implementation of the incident command system, the employer's emergency response plan, and the local emergency response plan. Knowledge of hazards and the risks associated with chemical protective clothing. Specific information regarding the state emergency response plan and the federal regional response team. And an understanding of the importance of decontamination procedures. Under the HAZWOPER standards, there are also training requirements for those engaged in emergency response work at uncontrolled hazardous waste sites and RCRA TSD facilities. The worker protection standards do not provide any specific hours or levels of training for these situations. However, the rule of thumb is that an employee must be trained to a level of competency commensurate with the duties and risks to be assumed. Anytime the potential for exposure is increased, the training should rise accordingly. Hazardous waste and emergency response operations can potentially expose workers to toxic chemicals, safety threats, biological hazards, and radiation. A medical monitoring program is an essential companion to training in order to monitor and assess employee health. The worker protection standards require that the following groups be medically surveyed: employees exposed to permissible exposure limits of hazardous substances for 30 or more days per year, Employees wearing a respirator for 30 or more days per year. This would not pertain to regular firefighting activities. Hazardous materials specialists, members of hazmat teams, and employees injured due to possible overexposure during an emergency incident or showing symptoms of illness from possible exposure to hazardous substances. Employees in the first 4 categories must undergo a baseline medical examination without cost to the employee prior to field assignment. This is followed by additional medical examinations on a yearly or biennial basis, depending on the attending physician. However, no matter what regular schedule an employee is on, a medical examination must be given immediately if the employee is injured, becomes ill, or develops symptoms from potential exposure to hazardous substances. Lastly, at the end of employment, a closing medical exam is required if a regular examination has not taken place in the previous 6 months. While the content of these physicals should be determined by the attending physician, certain key elements are essential. There must be a complete medical and work history taken, one that is specifically related to the employee's duties and potential exposure levels. The physician must also certify an employee's fitness for wearing personal protective equipment under worksite conditions. Once the exam is completed, the physician submits a written opinion to the employer. This contains the results of the examination. It also includes required occupational limitations, recommendations for further testing, or any other conditions that would limit worker activities. Medical records of these examinations, testing, physicians' opinions, complaints related to exposure, and any medical records forwarded to the attending doctor will be maintained by the employer for a period of 30 years after the last date an employee works with hazardous substances. The Worker Protection Standards specify that all medical examinations required as part of a medical monitoring program be provided without charge to the employee. The Worker Protection Standards have been established to provide the maximum protection to workers in the hazardous materials field.
The EPA's Environmental Response Team, in conjunction with other agencies and programs, has produced numerous guidance materials, provided training, and held workshops to help the regulated community understand all of these requirements. The U.S. EPA Audit Guidelines is a step-by-step guidance manual to help assess preliminary evaluations, health and safety plans, and off-site emergency response plans that are required by the Worker Protection Standard. The Hazmat Team Planning Guidance assists local communities with the development of a hazmat team. HASP, Health and Safety Planner, is a computer-assisted, site-specific health and safety plan. The program uses an automated decision-making process to reduce data retrieval and integration time. The Field Certification Tracking System, or FCTS, is a computer-automated system that simplifies the record-keeping demands of the HAZWOPER. Other ERT publications that deal with these standards are the Standard Operating Safety Guides, the ERT Training Catalog, and several other documents originating directly from the 1990 HAZWOPER workshops, such as the Worker Protection Standard Workshop Information Packet, and 5 Worker Protection Fact Sheets. One outlines the requirements at uncontrolled hazardous waste cleanup sites. Another compares the HAZWOPER to other relevant statutes. A third concerns emergency response and RCRA TSD requirements. The 4th fact sheet details procedures and considerations for the establishment of work zones at hazardous waste sites. And the final fact sheet lists and explains the guidance materials which are applicable to the HAZWOPER standards. To request copies of any of these documents or for additional information on EPA's implementation activities, please contact the Environmental Response Team at area code 908-321-6740 and ask for health and safety. There are other sources of information and guidance as well. The catalog of Superfund publications provides a comprehensive listing of all documents currently available from EPA's Office of Solid Waste and Emergency Response. It also provides order forms and instructions for obtaining these documents. This catalog is available through the National Technical Information Service, or NTIS, at area code 703-487-4650. Please ask for the publication number appearing on the screen. The EPA has a toll-free hotline to request information and guidance on RCRA and Superfund. That number is 1-800-424-9346. There is still another group within EPA that can assist local communities with emergency response planning. The Chemical Emergency Preparedness and Prevention Office can provide useful data for prevention or response to a hazardous material emergency. Their toll-free number is 1-800-535-0202. The EPA is happy to assist the regulated community with the worker protection standards. However, to avoid inconsistencies, official interpretation of the worker protection standards must be obtained from OSHA's Office of Health Compliance. Their number in Washington is area code 202-523-8036. Congress has also required OSHA to develop certification procedures for the training programs specified in the worker protection standards. These are codified at 29 CFR 1910.121. For additional information on this training accreditation rule, please contact OSHA at area code 202-523-7216. Risks will vary with each response due to unknown substances and exposure levels. An individual locale's planning, training, and medical monitoring needs depend on the types and amounts of hazardous materials and wastes that are located in and transported through the local community. They also depend on the nature and scope of individual responsibilities during a hazmat incident. The most successful response programs for meeting local needs are often the most creative ones. In order to meet these challenges, responders must have the proper training to perform their jobs safely and intelligently.